Hello, and welcome to today's presentation. Welcome back to Business as Unusual, Practicing Tomorrow's Veterinary Medicine Today. Today's webinar is being presented by Virox Animal Health, makers of rescue and prevail disinfectants formulated with accelerated hydrogen peroxide. Accelerated hydrogen peroxide is often chosen in times of outbreak or in daily use for its unparalleled combination of safety and efficacy. Rescue and Prevail are available in dilutable concentrates, ready-to-use liquids, and pre-saturated wipes with contact times as short as 1 minute. You will have the opportunity to submit your questions by typing them in the chat located on the right side of your screen. Please send in your questions at any time during this presentation. Our team is standing by to answer any questions that you have. So without any further ado, let's get started. I would now like to introduce veterinary technician Teresa Mariscal and America's veterinarian, Dr. Marty Becker, founder of Fear Free. So over to you, Dr. Becker.
Thank you. Actually, this is not Dr. Becker. This is Dr. Evan Anton, the world's sexiest veterinarian, cleverly disguised as Dr. Marty Becker. Listen, I hope all of you are safe wherever you are at. We got some incredible times that are horrible. And also there's good and goodness that comes out of it. And all of us, I think, have found things we never expected to find, whether it's our clients finding a richer, deeper relationship with their pet, and myself finding a richer, deeper relationship with my mother-in-law, because I've been spending 3 hours, 3 days a week, driving her around out of isolation and just talking. And it's pretty interesting when you talk to your 95-year-old mother-in-law about her love life, and I'll just leave it at that. So COVID, when I talk about having to hold the love and the cherries till death do us part, I got to tell you something that's amazing. Dr. Ed Cragen is the past president of the Mayo Clinic in Rochester, Minnesota. The Mayo Clinic in Rochester is widely recognized as the top medical facility in the world. Dr. Cragen has won the Distinguished Clinician Award, which is their top award. He's quadruple boarded, 4 boards, internal medicine, oncology, hospice, and palliative care. He's the author of the #1 New York Times bestseller, How Not to Become My Patient. Okay, Dr. Cragen has prescribed pets on a prescription pad over 1,000 times in his career. Lab instead of Lipitor, Poodle instead of Prozac. I don't know what other corny things I could come up with. But listen to this. Speaking specifically of COVID, he said the 2 things you can do to best protect yourself. #1 is limit exposure. Yeah, the mask and social distancing. #2, healthy immune system. And the #1 thing for a healthy immune system from Ed Cragen from the Mayo Clinic is a healthy, loving relationship with your pet. Fear, anxiety, and stress are what the old cortisol releases, depresses the immune system. And when you don't have fear, anxiety, and stress, or it's reduced and you're happy and calm, you have a healthier immune system. So the #1 thing he thinks about is the family pet. I want you to think back to your first journey to become a veterinary nurse, a veterinary technician, a veterinary receptionist, or veterinarian. For many of us, it started out 6 or 7 years old. I wanted to be a dairy practitioner. That career lasted exactly 30 minutes. First hour, the first day of class at Washington State University's College of Veterinary Medicine, the dean got up and gave a talk on the human-animal bond. He had been a Jewish prisoner of war in Sobibor. He was befriended by a Malinois. And so a dog that was supposed to guard him and scare him is actually one where he discovered the human-animal bond. But all of us got in veterinary medicine, I would almost guarantee you, because we loved pets or we loved animals and we wanted them to love us back. Nobody gets in veterinary medicine to make life worse for animals. And unfortunately, before Fear Free, that's what a lot of us were doing because we were taught restraint. We were taught to look at the physical well-being of animals, but not about the emotional well-being of animals. And here we are just about a month away from the 4th of July. And even today, millions, tens of millions of dogs will think they're going to die unnecessarily when all they would need to do would be to go to a veterinarian, a veterinary practice that looks at the emotional well-being of animals and be privy and partner and a recipient of the medications we have, whether it's Celio or it's alprazolam or it's Zilkine. That's what we've got to do. So who and what and why are we leading and towards what? We celebrate and protect and nurture the human-animal bond. In my lifetime, the first time was 1963 when the Beatles invaded North America. We first got to bring Luke, the Labrador Retriever, from the outside to the inside of our house. He went from the barnyard to the backyard to the back door to the bedroom. And you know what? Literally and figuratively, Luke, the Labrador Retriever, never left. He still had a utilitarian role. He herded cattle, he hunted, he retrieved ducks, he guarded our stuff, but now he had a more emotional role because we had a more intimate relationship with him. And that's about the time in the 60s where there was migration of biblical proportions from pets from the backyard to the back door to the bedroom, or put another way, from outside to inside to underneath the covers to sleep. And now I've seen it go in my lifetime, in 40 years of veterinary medicine, from an animal to a pet to a family member to a child. And now, if we listen to Dr. Cragen, it's a human life support system cleverly disguised as a four-legged child. One of the things I want to point out here, this bond, what is the bond? It's this affection connection. How do you describe love? It's nebulous but easily understood by anybody that's ever felt it. I tell you how I describe this bond. There's only one greatest pet in the world, and every family has her, or every individual has her. I've been blessed to write 23 books, sell 8 million books, do network TV for 26 years. And I don't care if it's celebrities or sports stars or politicians or somebody down and out, a homeless person on the street. You can lose your job. You can lose your 401k. You can lose your hair. No, I'm not on chemo. It's just 65 years old with bad genetics, but you're never going to lose the unconditional love of the pet. And I tell you, when everything, the whole world seems upside down, you draw close to the things you know are rock solid. There's 3 things you'd be accused of in veterinary medicine: missing a diagnosis, being late for an appointment, charging too much. But the one thing you can't be accused of is not looking after the best interests of the pet. We are pediatricians for life. Think of this: when we get ready to get a COVID vaccine, we're going to know why we're getting it, why it benefits it, and we're going to know it may hurt for 30 seconds. And if it really, our arm is sore, we can take an over-the-counter product. Guess what? Animals never know why a procedure benefits them, and they can't anticipate or expect the relief of pain. Just like pediatricians, we're pediatricians for life when we work in veterinary medicine. And you can't just look at physical well-being, you have to look at emotional well-being as well. And that's the one thing you change in your practice. By the way, I hate it when people do that dang heart thing everywhere. I see bit at Instagram with the sunset and the heart thing. I love this one, the person and their pet. And I tell you what, if you're like me, every night, I love to watch TV, and we get up there in the TV on the couch, and we've got a pet in my lap, rhythmically stroking the pet. And I tell you what happens. If you do that in about 60 seconds, there's this massive release of positive biochemicals. Oxytocin, the hug hormone, phenylethylamine, that active ingredient in chocolate, prolactin, like a mother nurses a baby, serotonin, the runner's high, or what I take an antidepressant for. Guess what? The dog gets exactly the same biochemical spa treatment. There's a reason there hasn't been another domesticated species in 4,000 years, and only dogs and cats have broken down our hearts and homes in mass. That's what we do in veterinary medicine: celebrate, protect, and nurture that special relationship that people have with their pets. And it's not just physical well-being, it's emotional well-being. One of the things I say when I'm doing live lectures, I'm going to tell you right now, if you're looking at the emotional well-being of animals, no more Pilotex restraint for any procedure, period. No more rodeo, no more judo throw, no more rugby scrum, no mass gang tackle. This is actually not a setup picture. The crazy thing about this, there is a German Shepherd underneath that pile. If you look underneath the girl in the bright green smock, you'll see its head is muzzled. It's a German Shepherd. This is right after the movie A Dog's Purpose came out, Bruce Cameron's movie. There was a leaked video of Hercules, the German Shepherd, that was shown being pushed back down into a tank. and there was this outcry. It probably dropped the movie premiere, they figure, about 30% because of the outcry. That was on a Friday. This was taken the following Monday at a veterinary hospital to get a blood sample. What if the public saw that compared to what happened to Hercules, the dog? I love this stock photo, and I'm getting ready to end here and turn this over to Teresa Mariscal, who's in the trenches of veterinary medicine during the time of COVID. Look at this guy, arms folded, blue veterinary smock on. Look over his left shoulder, the gal in the blue smock, the long hair with a chokehold on the cat. Oh, here he is now with an apron on. She's changed into a great thing with this beautiful smile holding it. So there he is, veterinarian. Here he is working in the pet store. What that means is far too many pets now. They're adopted at a shelter. Even with a complimentary veterinary exam, they don't come in. Visits to the vet by people that have recently acquired a pet is down 30% in the last 2 years, even with a complimentary exam. They go to PetSmart or Petco or whatever the chain is where you're watching. They get upsold on super premium food. There goes their discretionary pet healthcare dollars. They also buy the parasite control on the way out. We've lost relevance, we've lost share of mind, and they're out of the buying pattern. These all three are very dangerous. I happen to have a 10-year-old granddaughter. But let's say if you have a nephew or niece or grandchild or child that's this age, when they cry, we don't go, "Hey, shut up. The president's on talking about the protests," or we're watching Game of Thrones, binge watching. Just shut up. No. Is the baby sick, tired, gas, hungry, needs a nap, whatever we respond? Well, the pets that you see are also crying, but it's just done in the sign of fear, anxiety, and stress. So I'm going to stop here and turn this over to Teresa, and then I'll be visiting you in a few minutes again. And by the way, if we go a little long, we know if you have to go ahead and go. And if you can't watch the whole thing, maybe you could watch it at the end.
Thank you so much, Dr. Becker. For those of you that don't know me, I am a veterinary technician over at Blum Animal Hospital in Chicago. This is actually one of the exams that we have done recently. This is one of our veterinary technicians and one of our doctors performing an exam in a room. Typically, before COVID, we had exams with owners in the rooms. Owners would help give treats during the exams. Technicians or assistants would help hold the pet. But due to COVID, now we don't have owners coming into buildings. So now we have technicians and assistants very hands-on with the doctors in the exam rooms. So this is just one of those pictures just kind of demonstrating what's going on in our hospitals right now. This is definitely something that we never envisioned we would have to do, but it's something that we are adjusting to every single day. And quite honestly, a lot of us really, really enjoy it. So what are some of the changes that we've implemented? For us, we are a very narrow building. So for us, social distancing and kind of trying to keep distance from each other is very difficult. One way that we have done that is actually by splitting up teams. So what we have done is we have assigned technicians and assistants to doctors, and really trying to make sure that only those people within teams are interacting, making sure that we are keeping our distance. So we have visual markers kind of up and down our lab. We have visual markers in our lobby to really show us what is 6 feet, making sure that we're keeping not only ourselves as individuals 6 feet apart, but also those pets. We actually also have multiple floors, so that has allowed us to split up our teams. We have some people practicing on the first floor. We have some people practicing on the second floor. The very biggest and most important thing is making sure that we are using personal protective equipment. So you'll see all of us with masks on during the day. We will also use gloves for our appointments. So we will switch out gloves between patients. Just to kind of really minimize any contact with anything, the dog's leash or collar may be carrying, really just trying to keep ourselves safe. We also, like I said, we no longer have clients in the buildings. So we will meet owners at the front door, go ahead and exchange the pet and bring the pet on into the exam room. The only real exception that we have to this is during euthanasias. We will allow owners to come into the building, making sure that they are there for their pet's last moments. Of course, they will also be wearing gloves and masks, and we will fully gown up just to make sure, again, that there is as little contamination as possible. So again, just like I said, if you notice that picture on the left here, this is our lobby. The X's are the 6 feet apart markers for us. When we finish up an appointment, we do go wait in the front lobby until the owner is ready to meet us at the front door. And just making sure that we're 6 feet apart. Another way that we have instituted that social distancing is by splitting up workstations. So this is one of the workstations on the right-hand side of one of our veterinary care coordinators, really just trying to space them apart, but still being able to do everything that we normally are doing. You notice a little bit further off to the right, that's some medication we fill. We have made it a habit of making sure that all of our medication is pre-filled, ready for the owner to pick up as soon as they arrive. So the next biggest thing is not only are we protecting ourselves, but we are also protecting our clients and our patients. The personal protective equipment that we're wearing, our masks, our gloves, our gowns, we're just making sure that really as little any kind of contaminants are on ourselves, and that we're able to transfer that to the patient. This, of course, is just a mask, just showing you guys a little something. And really want to touch on how fear-free boosts biosecurity. So for fear-free, we're noticing a lot more frequent disinfections. That's something that we were already doing before COVID started. So making sure that we're using our rescue between patients, trying to eliminate any enzymes that were left from the previous patient to the next patient. So we're definitely making sure that we're using rescue as much as possible between our appointments, making sure that we are wiping down all of our stethoscopes, any kind of ear equipment, otoscopes, making sure that's all properly cleaned between appointments, more now than ever. Making sure that our hand washing habits are as up to par as possible. A lot of us will sing Twinkle, Twinkle, Little Star, just to make sure, you know, we're washing our hands as long as we should be. And again, just touching on, you know, handling possibly contagious patients. So not just, oh, this patient might have been exposed to a person that may be COVID positive or showing any kind of COVID symptoms, but just patients that are sneezing, that are coughing, anything that could possibly be passed on to another patient, making sure, again, we are fully gowning up, we are using all of our personal protective equipment, and just really, really keeping in mind the safety of our patients, our clients, and ourselves. So what challenges has COVID created for us? So prior to COVID, like I said, we did have our clients coming into the building. They were helping us out, being there for their pet as emotional support. Some pets get very nervous when their parents aren't around. And now even more so, I would say, because now not only do you have a person that you don't necessarily recognize in a building that you're not super familiar with, but now you have people wearing masks. Now you have people wearing gloves. So now this patient that, you know, may have come in with his parents and only been at an FAS1, at an FAS2, now we are noticing that some patients are more nervous without their parents. You know, we are experiencing some separation anxiety. So it's something that we are on a daily basis making sure to stay on top of. And I think fear-free has really contributed to making this a positive experience, in that, you know, making sure that we are using Considerate approach, that we are using all of our fear-free treats. We have gone very heavy on the hot dogs and the cheese, our tuna supply, making sure that's really up to stock there. And really just making sure that everything is going as smoothly as possible. So how we've been preparing pet parents during this crisis. One of the biggest things that we've done is making sure that we have sent out email blasts and posted on our social media, letting owners know what to expect when they drop their pets off. Letting them know that it's going to be a drop-off, that they aren't allowed into the building. Really trying to keep that communication as clear as possible with them. And then we have definitely seen an increase in the use of pre-visit pharmaceuticals. Something that we already were using prior to COVID. But now even more so, especially like I said, with those patients that are experiencing separation anxiety, or really just the fear of us, being masked, being gloved, even looking more strange than we were previously. Another option that we have offered to clients is the option for drop-off appointments and injectable sedation if needed, just to kind of really facilitate as fear-free as possible of an exam. So what to expect during the exams for COVID. During this time, like I said, we do have owners go ahead and drop off their pets. So what they will do is they will give us a call when they are ready to check in for their appointment. If their doctor, their technician, and assistant are all ready to go ahead and move on to that appointment, we'll go ahead and have the owners meet us at the front door. Once we have met at the front door, we will go ahead, make sure that the number that we have on file is correct, because we will be calling them during the exam. We'll go ahead and exchange the pet, bring them on into the room. Once we're in the room, our doctor goes ahead and gives the owner a call, and everything is performed with the owner on the phone. So doctor generally will introduce themselves, ask, why is Fluffy here for their appointment, any questions, concerns that they need addressed at that time. We'll go ahead and get started with that exam. So while the owner's on the phone, the doctor will go ahead and check out, the dog from nose to tail, and addressing anything that the doctor finds at that time. Once the exam is completed, the doctor will make the recommendations as far as what diagnostics we think would be appropriate, or, if there's not diagnostics, what are the next steps to address Fluffy's issues. Once those issues have been addressed, the dog will be taken by the technician or the assistant, and we will go ahead and do any diagnostics, fill any medication that needs to be filled, and kind of next steps from there. Once all of that is done, we will also call the owner after the exam is done, just to let them know, this is what we have gone over today, and just kind of do our checkout over the phone as well. Again, just kind of what to expect after the exam. So this is just one of our veterinary care coordinators. She was actually checking out a client at the time, letting them know, this is what we performed today with one of our doctors. Do you have any questions, any concerns? Would you like us to go ahead and schedule that next appointment for you? And we will do contactless payment. So we will actually take all of your information over the phone, whether that be credit card, debit card, care credit. We will do all of that over the phone, and then just kind of setting up anything that needs to be done afterwards. So on the right-hand side, I just kind of showed a little example of what might be like a Skype call. So anything that needs like a demonstration, such as, allergy injection shots, how to give sub-Q fluids, we will do that all via like a video call, just to make sure that we are still able to show the owner how to do what needs to be done while also keeping them, their pet, and ourselves safe. One of the biggest things I think right now is just making sure that our clients are educated about how to deal with everything that's going on while being at home with their pet. So the biggest things I would say would be, separation anxiety. Like I said, the biggest thing when they're dropping their pet off is suddenly their owner's not going to be with them. They're in a building that they don't recognize with people that they don't recognize. So making sure that if they need pre-visit pharmaceuticals, that is addressed, making sure that they are ready for that car ride. We do have patients that sometimes get a little bit nauseous when they go on car rides, making sure that they have any medication that they might need to make that transition from home to veterinary hospital as smooth as possible. And then while they're at home, just making sure that their pets are mentally stimulated. So for example, here we have this dog eating a frozen Kong, just kind of making sure that they are still staying busy at home and aren't experiencing any kind of anxiety from not having any outlets for that energy. And just also, like I said, talking through fear-free strategies as far as making sure that they have any medication that they need beforehand, pre-visit pharmaceuticals, treats in the hospital, treats at home, and really making that as smooth as a transition as possible. So is COVID-19 all bad for veterinary medicine? I think this is where there might be a little bit of discussion between, whether it's a positive or a negative thing. For us, I would say, I think a lot of us in the hospitals, we are really, really enjoying this time with the patients. I think we are really strengthening our bond with the pets because we have to be so much more hands-on with them. I've got a couple of pictures here just kind of showing just the time that we have really been enjoying with the pets. So this is actually one of our technicians, Sarah. She absolutely adores Labradors. So this was one of our patients that came in. And really, like I said, we're just really enjoying this hands-on time that we have with the patients, really trying to strengthen that bond that we have with them that we might not have had the time for before. Like I said, typically previous exams were done with owners in the room. They were only briefly taken out for any kind of diagnostics that needed to be done, or, like a quick nail trim. So now we are able to spend more hands-on time with the patients, and I think that is such a positive thing for us and for the patients. Again, just some more pictures. On the left-hand side is myself just hanging out with the puppy. We've got our technician, Jill, over here also hanging out with the puppy. We've definitely seen a ton more puppies now. And it's, during these difficult times, I would say it's such a pleasure to see them. Definitely highlight of our day to get to see some puppies, some kittens, just something more than just, having to gown up and do all of our exams very routinely. Again, so another way that I think that this has definitely helped us is, with our increased disinfection protocols, we see a lot more cleaning going on, making sure that we're staying on top of everything. We've definitely seen a lot more team building. So on the right-hand side here, we spent a couple of weeks doing Spirit Weeks, and this was just one of those examples where we all kind of dressed up, did some funky makeup, and it definitely has just made this time that, is already very difficult for us a lot more fun and enjoyable for us within the hospital. You definitely see some closer bonds between the employees. So I think, to answer that question, is COVID-19 really all that bad for veterinary medicine? I don't think so for us. I think it's made such a positive influence on us with, making sure that those bonds between employees, those bonds between us as employees and those pets, so much stronger. So what's ahead? I think going forward, making sure that we continue on with that team building, making sure that we continue making sure that we are as efficient as possible, especially now that during COVID, we have had to do, some cross training to make sure that our workflow is as smooth as possible. And then going forward with telemedicine, this has definitely been an eye-opening experience, knowing that we are able to do this and that we have had to do this really just at a drop's notice, knowing that we are capable of doing this, and going forward, this is definitely something that we are going to expand on and that we can help improve if something like this were to ever happen again. I'm going to go ahead and hand this back on over to Dr. Becker. Thank you so much. Dr. Becker, whenever you're ready.
Teresa misspoke again. This is Dr. Evan Anton. I take off my shirt and show you my body so you know I'm the world's sexiest veterinarian. I'll tell you, Teresa, that was unbelievable. You have to know that Teresa's not somebody you'd see at every conference or see at every webinar. So I know she was a little nervous for that, but man, for coming out of the box, that was unbelievable. And I have a feeling, Teresa, that if we see you on caffeine, because you got energy that was just blasting out of the screen, man. But then you bring it down with your stuff with the puppies and your team. And it's really funny with Fear Free, and I'm a board member of American Humane, and they've all been working remotely. They're closer and know more about each other now working apart than they did working together, because they'll have these little coffee time chats. And last night, that's at American Humane, once a week, they all get together and coffee or something much stronger. And I know for Fear Free, we have game nights where we all play online together, but we've had a lot of one-on-one time. And so there's really been a lot of benefits that we've seen from that was totally unexpected. And I really like that part about, One of the things that I would like to stress here, we always like to say, let's practice today like the pet parent is right there looking over our back. If we were there practicing like the pet parent or the pet guardian or the pet owner, whatever you want to call it, was right there looking over our back, would we ever have 5 people holding their dog down? Would we ever be jerking it around if it was struggling when the amateur phlebotomist missed the vein the first 2 or 3 times? How would you like to have that happen? How about the dog that was struggling because it's got a sore ear and the first time an otoscope was ever put in its ears when it's sore? You have to understand, almost every animal, every pet that comes into a veterinary practice is in pain. Let's set aside wellness visits for a minute. They've got a torn nail, they've got a cheatgrass on, they've got a sore ear, they got sore gums, they've been vomiting, they've got diarrhea, they got an abscess. All those things are painful, and they don't know why they're in to see us. They don't know that examining their skin and doing a skin scraping is going to help them. They don't know that a vaccination or examining a wound is going to help them. And unlike us, they can't anticipate or expect the relief of fear, anxiety, and stress or pain, even if it's moments away. And it bears repeating, fear is caused by something painful or something disturbing. Painful, nails trimmed too short. Disturbing, now seeing the nail trimmers. Or for that dog, it walks that same path through the doors, back in the back, up to the treatment tub. Here comes 3 or 4 people to hold it down and put a muzzle on to trim its nails. Not okay. We have to look at that. If you think of that as a 4-legged child, and it's not okay that it thinks it's going to die. We now know how to treat them. We know how to take the pet out of petrified. We know how to put the treat into treatment. And this thing with fear-free is not me. Fear-free is we. I'm just a spokesperson, somebody that's doggedly determined and a networker to get this thing done. There's 60 boarded behaviorists of the 87 that are the bedrock of fear-free. There's 12 boarded anesthesiologists on the sedation protocols working with the boarded behaviorists. Dr. Steve Ettinger, the world's most famous veterinarian, is our chief medical officer. I could go through these lists of medical people, but fear-free is the right thing to do. We match up with our oaths to prevent or relieve animal pain and suffering. It's better medicine. Why is it better medicine? The pet that has pain and sensitivity at home, if it doesn't have fear, anxiety, and stress, and in the fight or flight mode, shows the same pain and sensitivity in the practice. The vital signs, temperature, pulse, respiration. If the pet is calm, if the temperature is up, it may be a fever, not stress from shivering and shaking and panting. If the heart rate or the respiratory rate is up, it might be the signs of pathology. So your temperature, pulse, respiration are more normal. The blood chemistries are more normal. If they're not in that fight or flight response, we don't get the leukocyte shift. So if you start to see an increase in white blood cell count, it might be infection. See an increase or leukemia. See an increase in blood glucose, might be pre-diabetic, not just stress. It's easier to attract and retain people. Remember, nobody wants to get involved with making life worse for animals. And according to last year, a NAVTA survey, North American Veterinary Technicians Association, 60% of the people that had received an LVT, RVT, or CVT degree, that's 2 years, $40,000 to get your degree. At the end of 5 years, 6 out of 10 had dropped out of the profession. Why? You knew the hours, you knew the money. Why? You didn't perceive the brutality of practice. Fear-free is more profitable. If you go to fearfreepets.com, there's a great thing there on the profitability for the 2nd year in a row. We've got some great data. I think more than anything else, it just makes practice fun again. Oh my God, to have dogs drag the owner into the hospital and not want to leave, to have cats be at least neutral. In the practice I work at, North Idaho Animal Hospital in Sandpoint, Idaho, is one of about 150 practices that are fear-free certified. And by the way, there's over 100,000 of you that are now fear-free certified, veterinarians, technicians, nurses, receptionists, kennel attendants, 100,000 in 46 countries. Of the 30 veterinary schools that are currently operating in the United States, 22 now require fear-free certification of all students. So it just makes it fun to go down there where these pets want to be seen. 85% of the cats that come into North Idaho Animal Hospital now take treats. And I tell you, Teresa Mariscal talks about, that is one of the largest veterinary hospitals in the country in Chicago. Animal Medical Center in New York City, Angel Memorial in Boston, 300 veterinarians at Angel Memorial are all fear-free. Go to their website, Angel Memorial in Boston, take a look, scroll down, they're fear-free certified. Let's get back to the talk here. My sister Cheryl's a physician. She's my older sister. When she was young, I watched her getting her ponytail pulled at the dentist's office to keep her mouth open. Dr. Kern would go, Cheryl, keep your mouth open. Cheryl, like a human Pez dispenser, he'd kind of jokingly but strongly jerk her ponytail down to get her to keep her mouth open. Well, guess what? Cheryl was freaked out her whole life. She knew she could take alprazolam or Loravan or something like that, but she just never got her teeth taken care of. This is not my granddaughter Reagan, but it almost looks like her. She goes to the Granite Hills Dental Spa. She gets to sit in a heated catcher's mitt. She gets to pick the color of the LED lights above. It's a communal room. You don't go to a separate room. There's 6 chairs in a circle, like pieces of a pie. She gets to pick what's on the LED screen above her head. She loves to watch SpongeBob. She gets a heated blanket if she wants it, animal assisted therapy if she needs it, noise cancellation headphones just like you have on an airplane, anti-glare glasses. Imagine her in this heated catcher's mitt, laying down with this little whatever light she wanted in her circle or her wedge of the pie, watching SpongeBob with noise cancellation headphones on and anti-glare glasses, knowing at the end she gets the most incredible choice of toys you've ever seen. Not a little new toothbrush, a miniature tube of toothpaste, and some dental floss like I got and you probably got. So we're not the first healthcare profession to change. Dentistry had to change, pediatric dentistry, pediatric oncology, pediatric medicine, till again, they don't know why the procedure benefits them. Look at this dog, head turned away, ears flattened, pet is rigid, probably about getting ready to bite. We haven't wanted him to watch. We always took this stuff in the back, and that way if something bad happened or the pet cried out or we had to jerk its leg or we cut the quick, nobody ever saw it. But again, we want to bring everything we can to the pet in the exam room. And now with COVID, things have changed a little bit, but having people go wait outside with their pets was something Fear-Free's been doing for 5 years. We didn't have them check in from the outside. We had them go in and check in and then go back out and wait in their vehicle. But we were way ahead of the curve because the worst possible place somebody could have to wait would be for a pet would be in the waiting room. God, I love GABA. I always think of Fred Flintstone when I think of GABA. Remember when he slides down, he's at the quarry and he slides down off the brontosaurus or whatever it is, and he goes, yabba dabba doo. I always think of GABA gabba doo. That's a veterinarian's cat on gabapentin. She sent me a picture. That's my son Lex's cat on gabapentin. By the way, my granddaughter named his cat Octopus. And Maui Wowie, I grew up in the 70s, and let me say, I inhaled a lot. I smoked dope like a chimney and drank my share of beer and had a great time in the 70s in veterinary school. And one of the best strains of marijuana was Maui Wowie. So that's my ode to my life in the 70s. Oh, look at this cat. Oh my God. This is a veterinarian sent this. This is a cat in a veterinary waiting room. Can already see its head. We have a cat at home. We have to give 200 milligrams to gabapentin to trim its nails, but the cat has a great experience. If you've gone through Fear-Free, you get 9 hours of race-approved CE with level 1 certification. 2 hours are just sedation protocols. You can go up to 500 milligrams on gabapentin, and many do in dealing with feral cats, but most of them are about at 100 milligrams. Module 1, level 1 Fear-Free certification, the pet owner has to deliver a calm pet. They can't deliver a wild cat or a rabid dog, so to speak, to us and have us take a stick of pepperoni and go, be still, my friend, and have a great visit. So that means they've got to get the carrier out a week before, not the morning of or the night before. They've got to start a magic carpet ride of pheromones, carrier to car to clinic. They have to have the pet come in very hungry, so it responds better to food rewards. They're going to preheat or pre-cool the car, so they go from 72 in their house to 72 in the car to 72 at the clinic. They're going to play a specific channel of Sirius XM music on the way in, and they're not going to baby talk. When they go in, pre-COVID, you checked in, go back out and wait in your vehicle. Now you wait in your vehicle and you call and go in. When the person comes, by the way, pets are territorial to the car and they're territorial to home. And so you've got to do something to not be transferred right at the car. But, Teresa went over a lot of good stuff on that. So we got to use a lot different pre-visit pharmaceuticals. If you're fear-free certified, you can go on to the fearfreepets.com or go on to the closed Facebook group and find out how some of the pre-visit pharmaceutical protocols have changed. That's just a picture of somebody waiting outside with their vehicle. Don't look directly in their eyes. Listen, before Fear Free, I was stretching cats out into 2 zip codes and have had more than one dog poop in my pocket trying to get a blood sample. I'm no Temple Grandin. Temple Grandin's probably the only gifted person on our Fear Free advisory group. She's amazing. But what's everybody do when they go to greet a pet? They lean over, they put their fist out, and they look right at them. Wrong, wrong, wrong. No direct eye contact. Don't put your fist out, and don't stare at them. So you don't want to loom over them like Halloween big and stare at them and put your fist out. Instead, you turn sideways. You bend down to make yourself appear smaller, pat your leg and see if they'll come over. You can glance at a pet, but do not have direct eye contact. We know certain kinds of music that pets like. Fear Free is a research-oriented company. If you look on fearfreepets.com, there's over 130 studies. We have funded over 12 studies right now. We know what colors pets like. We know they like fleece better than cotton towels. We know what music works. We know about the benefits of therapeutic massage and how pheromones and stuff work. There's music called I Calm Dog or I Calm Cat. You can buy the music players on Amazon for about $100. And that music is clinically proven to reduce fear, anxiety, and stress. Basically, pets like classical music. They also like reggae. The good thing about the I Calm Dog and I Calm Cat players, you can do Bluetooth, so you can download some stuff off Spotify or have your own kind of music list, but it shows that the room is curated for the species. So you've cleaned, by the way, and I'm going to see if this next one here, it's not just the choice of food we're going to talk about in a minute, putting the treat into treatment. It's a choice of where they're examined. They don't all have to get up on the exam room table, in their lap, in the carrier, on the counter, in the bench seat, on the floor on a yoga mat. That's a tremendous, tremendous benefit for them. One of the worst color you can possibly have for pets is white. It's because it flares when they see it in their spectrum that they see it. The best colors are pastel colors. And look at this, there's that guy again. Remember our veterinarian pet store combination employee? We used to love pets on a slippery surface, cold and high, because they wouldn't jump. Those poor pets, it'd be like you being examined up 3 feet off the ground on an ice skating rink. Temple Grandin, Dr. Steve Ettinger, world's most famous veterinarians, both think every pet should have their own bath mat that goes with them to the vet. Their smell, non-skid, soft. North Idaho Animal Hospital, the last time I practiced, here's my choices for treats: turkey hot dogs, deli turkey, shrimp, bacon bits, bacon strips, baby food, AD, peanut butter, easy cheese, cheddar and bacon, lamb lung, Braunschweiger, Kraft cheese slices. For cats, Costco tuna, Costco shrimp, Costco salmon, hot deli turkey, marshmallows, green olives, easy cheese, cheddar and bacon, whipped cream. Oh my God, cats love whipped cream. If I could only take one treat for dogs and cats, I was able to give one treat, period, and I was on a desert island practicing Fear Free, I would use what's called churu paste, CHURU. CHURU is the single most amazing treat I've ever seen. It's a Japanese company that manufactures in Thailand. CHURU. It looks like stuff in little yogurt pouches. Number one threat in human healthcare are needles. That's why 30% plus of the people say they don't want to get a COVID vaccine, and why 40% don't get a flu vaccine. And if you don't think size matters in a needle, ask a diabetic. So you want to draw the vaccine and stuff up with one needle, and you want to put on a brand new, sharp, very fine gauge needle when you deliver. We know, I was hearing the thing about Twinkle, Twinkle, Little Star that Teresa talked about. You want to give the vaccine over the period of between about 5 seconds is how long you want to deliver it. And make sure you do your stuff where you do the touch gradient. Think of every dog and cat like a little horse. Touch, touch, tint the skin. Touch, touch, tint the skin. Touch, touch, tint the skin. Then you deliver the vaccine. By the way, up front in the distraction technique, my number one favorite thing to do is to either use a little plastic, a silicone disc, or a little like a plastic charcuterie board, and write the pet's name in whipped cream, easy cheese, liver paste, Kong stuffing. Write the pet's name. Tell the pet parent to get their phone out because they're going to want to take a picture. And while the pet licks its own name off of that charcuterie board or the mat or the floor or the table, that's when you deliver the vaccine. Luckily, the pets and the people don't know what's done, although every once in a while they'll accuse you of not vaccinating their pet because it had absolutely no reaction. We call it a more comfortable injection experience. We use as Elanco's reduced volume vaccine line. So we tell people a more comfortable injection experience is we use a multivalent vaccine. So we can sometimes just use 1/2 of ml for all the vaccines, brand new needle, distraction techniques, using gradient touch and considerate approach. Your otoscope, think about this. If the only time you had an otoscope stuck in your ear was when it was sore, guess what? You'd always be afraid of that, just like the nail trimmers. Something hurtful, was that otoscope in my ear? Now something disturbing to see in the otoscope. You not only want to clean the otoscope and the stethoscope. After every visit, we clean my stethoscope with Viroxis Rescue. It's called Prevail in Canada. Every time we clean the stethoscope, and then we wipe back across it with a Feel Away or Adaptil, whichever species we're going to see next. Your otoscope cone, that stuff that's in that solution, that pet that's had a sore ear remembers that solution. Wipe back across it with Rescue or Prevail. Wipe back across with the pheromone wipe of the species you're going to see next. And don't forget the handle that's been plugged into the wall for about 10 years and never cleaned. Wipe across it with Rescue or Prevail. Wipe back across it with the appropriate pheromone. So they get food they never get at home. They get the choice of where they're examined and physical touch. There's a great book by Narda Robinson, who used to head integrative medicine at Colorado State University's College of Veterinary Medicine, by AHA Press, called Therapeutic Pet Massage. We do a lot of massage pre and post visits with these pets. Remember, if fear is caused by something painful or something disturbing. Here's my dog Quillen. I was out of town. My wife took the dog to a local veterinarian who happened to be her old boyfriend. We won't go into that whole thing about her love of veterinarians. And this dog was in extreme pain, vomiting. I told Tracy, better take it to the vet. So she takes it to the local vet, not the veterinary practice I work at that's about 50 miles from our house. So they told Teresa, come in and get Quillen. She's not eating, but we think she'll eat when she gets at home. My wife went in to pick Quillen up, big boxer pit bull cross, and she didn't even recognize Teresa. Teresa checked out just like everybody does, doesn't want to say anything, she's embarrassed, calls me. I said, we're going to take her straight to the veterinary group, or the Washington State University's College of Veterinary Medicine. I'm going to meet you in Spokane. We'll meet and we'll take her down together. We get into the thing and the senior student comes in and does the exam. And then she leaves to go talk to the attending veterinarian what she's found. While she's out, I feel Quillen's abdomen and I feel a foreign body. The attending veterinarian comes in with the veterinary student. I tell her I felt a foreign body. She goes, I think that's just a kidney. And I go, no, that's lower. She feels it again. I think that's a gas-filled loop of bowel. And I'm thinking, hey, I'm not even a very good vet, and that's no distended loop of bowel. But I knew they were going to go to imaging. Long story short, I asked her if she put her on pain medication. She didn't do it. I talked to the surgeon before they went into exploratory. And I said, is the dog on pain medication? She goes, I don't even think she's that painful. She just doesn't feel good. On the wall, it was September. It was National Pain Awareness Month, or Pain Awareness Month in there. A veterinarian advocating for his own pet at a veterinary teaching hospital could not get him to use pain medication. We need to think of sedation and analgesia as a first option, not a last resort. Think of those as a first option, not a last resort. Use sedation and analgesia early and often. Okay, I'm going to go real quick here. This is 2 new pets I just saw. The little ginger boy has a ginger cat. You're going to see the ginger cat disappear. He's under this towel right now. Those are the kind of pastel colors you like. This little, these guys are licking ice cream out of ice cream cones. The little ginger boy come over and told me they're not going to like it here so much they don't want to go home with us, are they? So we used our gradient touch, considered approach, distraction techniques. This veterinary hospital has 3 strains of catnip in an indoor garden. Each cat that comes in gets their choice of one of the strains of catnip to take home. They have a product called a yacker tracker in the back, and that yacker tracker is designed for preschools to keep noise down. You set the noise levels as long as it's under 180 decibels, that green goes. If it starts to get higher, the yellow comes on and glows. Okay, this cat had bitten 4 other vets in our town of Sandpoint, Idaho. How are we going to get a cat we've never seen before? No pre-visit pharmaceuticals with this cat. How are we going to weigh it? We weighed it on the floor. She's luring it up on the scale with deli turkey. Lardo's on scale. Now we got the weight. How are we going to get him up on the table? We enticed him up on the cat tree with deli turkey. Now he jumps on the thing. That took 40 seconds. 40 seconds from the time we started to weigh him until he was on the table. You notice there, by the way, pastel colored towel. There's a feline zoom groom right there beneath my right forearm. So a feline music, I calm cat, and the I calm zoom groom. Owner couldn't believe, by the way, we got done here using distraction techniques while you vaccinate. Owner couldn't believe the cat was that fat. That's the cat that had bitten 4 other veterinarians. Look at those people. The cat that had bit 4 other vets because he was scared. One last one, and I promise I'm done. Look at these 2 dogs. Pinned ears, tail down. One's hiding underneath the pet parent. Look at the pet parent, by the way, arms folded. I don't like this, right? I don't like taking these pets to the vet. Oh, I smell something. Oh, okay, I'll come over and check out this nurse over here. She's got something good. Oh, now I'm even more relaxed. I'm even up on the lift table. This is probably from the time they came into this picture is probably 40 seconds, 45 seconds. The big dog's already done. I'm avoiding eye contact with the small dog. Doing the vaccination. This is the one I like. Look at the body language. Now look how happy the big dog is. The pet parents, arms down, relaxed, happy. The little guy who hasn't looked like he's missed a meal. He's not whale-eyed. He's just using both eyes to stare at that other ice cream cone at the same time. All right, I'm going to turn it back over, I think, to the host and see if we have any questions. And I do want to say one last thing. I do want to give you my personal email, thebond@aol.com, thebond@aol.com. It's real handy when you're 65 to have an AOL address because you get really good ads for walk-in tubs and showers, lifts, stairs, constipation products, erectile dysfunction, hair, men's hair club for men. But if you ever have any questions about mental illness, I'm very open with my own depression issues. And if you have a personal or professional question, don't hesitate to email me, thebond@aol.com. All right.
Well, thank you so much, Dr. Becker and Teresa. That was fantastic. So we are just finishing up with the presentation here. You'll find a few slides at the end here for anyone who has any questions for where they can purchase Rescue or where they can purchase Prevail. They are right there. And Dr. Becker and Teresa, if you would like to rejoin us, we have a few questions from the audience.
By the way, I hate to say it, Lara, but we use Rescue ourselves during COVID. We love it. That's what we trust. Forget that alcohol,
Me too.
I know it's not supposed to talk about it, but it's the only one I trust. I love that stuff. And it doesn't have that, for people that don't know, it doesn't have that chemical smell, and it gets rid of that pheromonal pollution. But you've got to use it. We put it in a weed sprayer, and 4 times a day we spray the vertical surfaces on the outside of practice, and then we spritz back across with pheromones 4 times a day. So the first thing they do is smelling that vertical surface and going, "Oh God, I'm screwed coming in here," And yeah.
Well, that's good to hear. I'm glad you're staying safe. Now, our first question comes from Leah, who asks, what criteria will be used to reintroduce clients, and when will that happen?
Teresa?
I don't have a timeline as far as like when that will happen. I know that we anticipate at the very least for the next month that we still won't be reintroducing clients into our practice. I think we're really just playing it by ear at this point. We're not really sure where we're going to go with COVID. And so we really are trying to keep everyone's health in mind. So I don't have a straight answer as far as when. How, I think, at the very least, we'll slowly start allowing clients back into our building. Obviously, like I said, we do allow them in for euthanasias right now. But I think maybe we'll start allowing them slowly, a certain number in the lobby or in the rooms at a time, just to kind of still minimize the number of people that are there. But like I said, I just don't have a timeline, and that's kind of like the best answer that I can give as far as how we might start reintroducing them.
I want to say one thing here. It's the first time ever that we get to see a lot of pets without their parents. And that in some ways it's good, because you can get an FAS score without the pet parent there. Otherwise, we would never get it. Most people aren't not in there without their pet. So you don't know what the FAS score is. So take advantage and make sure that you write down the FAS score with the pet parent not there. And once this is over and people start coming back in, never say you're going to sedate their pet. Say you're going to give us something to calm their pet. Calm works a lot better than sedation for these people. And always, what I found that's worked over 40 years is just to say, your pet is so protective of you. I think she'd do better if you stepped out. That's a nice way of saying that little shit. I'd like to strike all over, but a little faster wall. It's so protective of you, and inside I'm thinking, you little shit.
Going back to kind of what Dr. Becker just said, the wordage that we typically use when we do feel that pre-visit pharmaceuticals are needed is we typically say, we just think that your pet could use something to take the edge off. Right. Definitely not something like, we feel that it needs to be sedated, or, he's behaving badly, Fluffy's a little bit nervous, you could probably benefit from something just to take the edge off. We want to make sure that his experience is as positive as possible here. So, just a little something to make sure that this visit continues to be positive for him, and any future visits continue to be positive for him.
Yeah.
Hey, Lara,
nice. Yeah.
Lara, I look like, Teresa's got beautiful eyes, and you do. My eyes look like coin slots in a vending machine. And my nose and I'm so white, these nose and glasses look like I got gag glasses on a marshmallow or something. So white. No, I got to get some more lighting here. Okay, I'm sorry.
We'll get better lighting for the next one.
Okay.
So the next question comes from Susan, who asks, can you estimate how much longer an average visit from arrival to discharge is taking at this time as opposed to pre-COVID practice?
I actually feel like they're a little bit quicker, just out of personal experience. I would say we're seeing, I think, less appointments, just because we are allowing space between appointments. We block off about 10 to 20 minute slots between appointments to give ourselves time to clean the room properly and get ready for the next appointment. But I feel that our exams and our diagnostics are actually moving a lot quicker than they used to. I think the fact that the owners aren't there allows us to really focus solely on the pet and really get to what the problem that they want addressed is, and just kind of cut to the chase and get whatever needs to get done. Obviously, still while keeping in mind, the pet FAS, but definitely there's a lot less chit chat between like the owners and the doctors, and we're really just able to focus on the pet themselves.
By the way, they're not having a riot in Bonners Ferry, population 2,200. It's every noon ever since it sounds 100 years old, they blare a siren at noon. So I know it's exactly noon here. Hey, by the way, some people think fear-free, Teresa's done this now for years, but they think fear-free takes too long. This go back before COVID, fear-free takes about 29 seconds longer, but the exam time is actually better. The one thing I want you to think about these pets, your pediatrician and this pet, so many of these miss their mom or their dad. And so it's so important to look at emotional well-being of them and that they aren't traumatized, because otherwise they leave and the old amygdala's got a negative experience and they can't tell mom and dad when it gets home, and we don't know the next time we see it. So we've got to be very careful to monitor FAS.
Yep.
Absolutely.
Yeah.
And sorry, go ahead.
Oh no, I was actually just going to say, I actually am fairly new to fear-free. I've only actually been with the practice for about a year and a half. So that's about how long I've been doing fear-free. But I enjoy it so much.
Thanks, Teresa.
Good. That's great to hear. And our next question comes from Andrea, who asks, are you routinely wearing masks when handling the pets, or are the masks being worn to work with the other staff and hand off pets to owners?
So we are wearing masks at all times from the moment we step into the hospital to the moment that we leave. It is just a standard. I think it's, I'm from Chicago, and in Chicago, we are required to wear a mask anytime you leave your house pretty much. So it's not necessarily for the pets themselves, but so much more for contact between staff and contact between staff and clients.
Okay. And next question comes from Sarah, who asks, for Skype, do you use a dedicated tablet or a smartphone?
I believe what we've been using, we have like a dedicated phone. We call it our Blum phone. And that is what we use to do like video chatting, just so that we don't have to use any of our personal phones, but so that we're still able to do those videos with the owners.
And Kaylee asks if you can go into more detail about options for utilizing telemedicine other than Skype calls to show basic procedures. How can it be utilized?
So for us, I would say most of our exams are actually done over the phone versus video cameras, just because all of our rooms aren't equipped with a camera. So we have been doing everything more so over the phone versus an actual video call. I think really the only time that we're using the telemedicine part for Skype is when we have to do demos. So we will, like I said, we show owners how to give sub-Q injections, how to pill a cat, kind of more along that nature. I would say it's probably one of the only times that we are using telemedicine versus just a simple phone call. Does that answer the question?
Yeah, absolutely. Okay, and the next question comes from Mary, who asks, how do you overcome owners' reluctance to sedate?
It's a good one.
I'd like to add, can I start?
Yeah, of course, please.
Strongly about that. If this were a child, if this were a two-legged child, would they want us to struggle with it and do whatever is necessary to hold that individual down? Or then let's go back to the days of pulling a ponytail. This is the equivalent of a child. And you sometimes need to explain to people often that pets have no idea why procedures benefit them, and they can't anticipate the effect of fear, anxiety, and stress, even if they literally think they're going to die. Teresa, now that you've been involved with Fear-Free, you can see the signs in an instant. And before, I used to see the signs before Fear-Free, 10 years ago, but I thought that's just collateral damage. They're panting, salivating, yawning, licking, shivering, shaking, jumping, hiding, leaning away, whale-eyed, curled up in a circle, head stuck away. Now I realize it's like a baby crying. They're telling us, I am distressed. And most of them, again, they literally think they're going to die. Mm-hmm. So first of all, just like we used to do what's called convenience euthanasia. I've been a veterinarian for over 40 years. I know I look awfully young, but I've been a veterinarian for over 40 years, and people would just drop the pet off and we'd euthanize it. They'd pay the money and just euthanize it like giving a vaccination. I used to do ear crops. I was really good at ear crops. I regret every one I ever did. We used to do declaws, hundreds of them. I regret every one of those I ever did. So veterinary medicine changes. We are not going to hold down an animal that thinks it's going to die. It's not safe for us. It's not what we do when we take an oath to prevent or relieve animal pain and suffering. A lot of it is in the explanation. When you first start requiring stuff like for nail trims or procedures, when you do something, you'll have people go, oh, by God, I've been going to the Plum Animal Hospital for 40 years when Dr. Blank was there and we never did it. Or I've been to 3 vets and I've had pets my whole life. Well, guess what? You find your happiness somewhere else. There are people in town that do nail trims without anything. Go ahead. We just can't do it here. And you'll have people, the thing is, you'll have some people leave, but for everyone that leaves, 10 come in their place because they hear that you're looking at the emotional well-being and that dog's tail is wagging and it doesn't have diarrhea for 3 days afterwards. And it doesn't come out just covered with sweat from people holding down. But I told them, listen, we can't continue as stressed as your pet is. We have, I said, I'm not going to sacrifice your pet's long-term emotional well-being for the convenience of getting it done today. So here's our 3 options. Retreat, another day, another way. Number 2, give it something orally if you can wait for 30 to 60 minutes for it to take effect. Or number 3, go straight to something intravenously that's going to calm your pet. They chose the one to give something orally. So that's what we did. The alprazolam took effect with a little Celio, and we were able to do the procedure easily, and they were delighted. I'm sorry, I just get so passionate about this.
No. Well, this is good because we actually do have a few more sedation-related questions coming up. So one comes from Gracie, who asks us, if you have not seen a patient in a few years due to fear of the vet and are unsure of their health, are the fear-free sedation protocols safe?
Dr. Becker, do you want to answer that one?
Well, here's what I would do. Here's what I always do. There's a lot of pets you haven't seen before. I start out with the baby step. The baby step are nutraceuticals. It may be a compression garment. It may just be the pheromones. It may be just not putting the pet up on the table. It may be using Zilkene. One thing you learn if you've used Zilkene from Vetiquinol, you're not using a high enough dose. We know from our boarded behaviorists and the boarded anesthesiologists, 60 boarded behaviorists, 12 boarded anesthesiologists, we know the dosages are different. So you can start out, even a pet you haven't seen, with Zilkene and a Thundershirt. But I'd start out with just Zilkene. And also Prina has a product called Calming Care, a probiotic that works really well. It can be episodically or long term. Then I would try something on the more benign end, like trazodone or gabapentin, or trazodone and gabapentin. And then if that doesn't work, I'd go to our more powerful prescription-only products. But it's got to be a philosophy of the practice. Sedate early and often. Now, I'm using sedate for us, not calming or take the edge off. Sedate early and often. Think of sedation as a first option, not a last resort. And channeling OJ at the trial, that famous words, if you can't abate, sedate. You'll find out. Just think of gabapentin. It's like a freaking miracle with these cats. Formerly, you'd have to pry them off the ceiling with a rabies pole. And now they're in there, like, instead of being effed, I used to say cats going to the veterinary hospital were effed. And Laura, you're thinking something naughty. I'm talking about fight, flight, freeze, or fidget. Fight, flight, freeze, or fidget. But with gabapentin, it's like, hey, far out, man, lose my Cheech and Chong. Like, man, wow, this is nice in here, man. Wow, I like it, That's the way it should be. Every pet should have the enjoyment of a phenomenal veterinary visit. And sometimes it takes chemical. Listen, I'm scarred from my childhood. That's why I'm on medication. And you just can't will yourself not to be depressed or not will yourself to have anxiety. Sometimes we need chemical crutches, and so do they.
And we actually just received another sedation-related question from Kaylee, who asks, do you require fasting for sedation?
I believe in our hospital, it's if it's injectable or something that could cause nausea, then yes. But I think for like if they are going home with like pre-visit pharmaceuticals, some GABA, some trazodone, then no.
I want to give you guys a tip, you guys that are on here, who's left. You're going to hear something for the first time. I predict this gorgeous man you see here that doesn't look 65, that my granddaughter told me last night that my wife is way out of my league. That shows you how good they think I look. So I predict in 2 years, we will be requiring, most of us, the majority of veterinary practices will ask pet parents to give small meals before they bring them in for anesthesia. And the reason I'm telling you that, it's already done on the human side. 2 family members in the last 6 months have had surgery, and both times they asked them to have a small meal. Now, why? Because you have less chance of nausea. 2, you get less buildup of stomach acid if you do vomit. So less chance of vomiting, and if you do, it's not as caustic. So they use a product, we use Serenia. They use a product that is similar. So what you're doing, you still take the same precautions like they're going to vomit. But what happens is it's more important to reduce fear, anxiety, and stress, because when you reduce the fear, anxiety, and stress, there's less nausea. There's the reason why it feels sick in our stomach when we're stressed. So by treating the FAS and giving them something and a small meal, but that widespread, that's still a couple of years away. But I know a lot of hospitals, including the one that we have, we actually encourage them to give a small meal. But it's going to change. So just mark my words, come back in a couple of years.
Well, staying on theme here, Abby asks, have you had clients complain that their pet, especially cats, are too sedated when they go home?
You want to go?
I'm trying to think, I think if it's an injectable sedative, then yes. Especially if that pet has like already been experiencing, if they were stressed before the sedative, then we know that they more than likely needed a higher dose to get them to come back down to a lower FAS. And so having to give them higher doses once they leave the hospital and that stress comes back down, then, when all that that's built up in their body, like obviously they're going to be more sedated in a comfortable environment than in an environment where they were stressed out.
I would definitely, we try to have fun with it. Like tell them, listen, your cat should not drive home. Your cat should not operate heavy equipment. Your cat should not build a climbing wall. And, there's people that pay to feel like your cat does right now. So, it's gone on a little trip and it depends on how fast it comes back out of it, but don't be concerned because they do act funny. And we in veterinary medicine, you recognize it and accept it, but all they see is something that's wobbly and doesn't act like it's know where it's at. So, but most of the people know if you explain it that way, and I always say, listen, it's almost like rebooting your computer. There's a lot of chemicals in your brain that all have to get lined up and a lot of circuits that get lined up, just like rebooting your computer. And for some cats, for some dogs, it's going to take longer.
Okay, and our last question comes from Lori, who asks, how are you all suggesting to your staff to handle the irate parents complaining about the wait and sometimes demanding to come in and the protocol to stay safe is inappropriate?
I think whenever we have clients call us to make an appointment, they know that, they are off the bat told about our protocol, what to expect as far as how their appointment is going to go. There's going to be a drop-off procedure. We'll let you know if we aren't able to see them right when your appointment starts. We will let you know when we are ready to see them. Meet us at the door. Please be wearing a mask. We will be wearing a mask. We will be wearing gloves. This is our normal right now. What to expect as far as the actual exam. Owners are prepped for all of that. That's not to say that we don't have, clients here and there that do get upset about our wait times. If we have emergencies, we will still try to see them. I think in that case, what we will do is instead of having the owner come and wait outside that entire time, we will actually bring the pet in, triage them, And then based on how emergent that case is will depend on when we will give the owner a call and when that pet will be able to leave. As far as, really dealing with the owners that are already irate, like I don't think that there is much to do other than, apologize and really try to get them to see where we're coming from as far as, this is not something that we could have ever planned for. This is unprecedented. We're all trying to adjust as best as we can to this situation, and we're just hoping that you can also see that from your point. We care very much about your pets. That is why we are still practicing. We care very much about our staff. That's why we have these protocols in place, and really just trying to get them to see eye to eye with us.
Teresa, you're good. We need to get you on more webinars, man.
Thank you. Very nervous during the Axel presentation.
Well, you want to acknowledge why they're stressed. I mean, there's people that are losing their jobs, losing their homes, they've lost their savings, and so it's normal. But a lot of times they'll take it out. Nobody likes to wait. I will say that for God. I mean, we're in a time when even instant gratification takes too long. It's just the way it is. But we are required workers. There's people that work in a veterinary hospital who would rather not be there working, and it's very long hours. And I just think sometimes with people it just acknowledge us and we're sorry, but these are like the way you describe that, at least acknowledge your feelings, even though in your mind you're thinking, can I punch you in the throat? And you're smiling, can I punch you in the throat? Yes, thank you. I acknowledge you're stressed. Oh, you just want to just give them one.
Oh, yeah, of course.
Yeah.
Well, that is great advice.
Every profession has their own inside humor. And if they only knew the way we did stuff sometimes, oh my God. I just heard today that I've been invited for the second time in a decade to be the keynote speaker for the International Cemetery Cremation and Funeral Association. Now, why? I'm not dead yet. Why would I address them? It's because there's about 1,600 of them that also have pet funeral homes, believe it or not in the same facility. But I still remember, what's the worst inside humor you have in your business? And they said, we're the last people to let you down. I don't know, I'm sorry.
All right. Well, on that note.
No hairstyling stuff, no questions on this?
No, actually, no. I think everyone's speechless. The hair looks great.
Oh, okay. Thank you.
So it looks like that's it for our questions that have come in. So thank you both. The presentation and the advice was amazing. And thank you to everyone for attending today's webinar. Welcome back to Business as Unusual, practicing tomorrow's veterinary medicine today. If you have any other questions, please visit rescuedisinfectants.com. You will also receive a follow-up email within 24 hours with a link to additional resources and a recording of today's webinar. So on behalf of Virox Animal Health and our presenters today, thank you for joining us, and thank you for your efforts in helping to contain the spread of COVID-19.